Hello, my name is Brittany.Owings and I'm a nurse practitioner student at Auburn University. I'm going to be performing a full head-to-toe assessment on my patient Chris. For purposes of this video, he would normally be in a gown, so I could assess all areas, but we're not going to do that today, as well as I'm only going to inspect one side of his body, such as one ear and one eye, for purposes of the video. I have already washed my hands. We have taken his height, his weight, and his vital signs, and they are all normal. I'm going to start out with inspecting his hair, his head, his scalp, his face, and his skin. I'm checking for distribution, any kind of infestations, or any kind of lesions. Next, I'm going to palpate his head for tenderness or for any kind of masses. Is that tender?
No.
Now I'm going to palpate the temporomandibular joint. I'm going to get you to open your mouth for me. Okay, it opens with ease, no crepitus or popping is noted. I'm going to check his sinuses, his maxillary, and his frontal for tenderness. Is any of that tender?
No.
Okay, those are normal. Next I'm going to inspect the nose. I'm going to inspect the turbinates. For patency, they are pink, moist, no drainage is noted, the septum is midline. I'm going to check patency. I'll get you to blow your nose out. Both nares are patent. At this time I'm going to check his mouth, his lips. They are pink, they're moist, no dry cracking noted. Get you to open your mouth for me. I'm going to check the buccal membranes. They are pink and moist. The roof of his mouth is pink and moist. Lift your tongue. Underneath his tongue is pink and moist. Check the back of your throat. Say ah.
Ah.
The back of the throat is moist, pink. Uvula is midline. His teeth are, they're okay. There are fillings present, but no present cavities. We'll check his gums. They are moist and pink. Okay. At this time, I'm going to move to the eye. I would inspect the outer eye, his eyebrows, his eyelashes, his eyelids. They are all even. His eyeballs, can you open yours for me, are round and symmetric. Pupils are approximately 3 millimeters, which is normal. I am going to inspect the conjunctiva, which is pink and moist. The sclera is white, no redness is noted. I can see his iris, his pupil, his sclera, and his cornea, and they are all normal, as well as his lacrimal duct is patent. I am now going to perform an ophthalmic exam. Check the light. Okay. I am looking at his fundus. I'm going to look at the optic disc, as well as any blood vessels, arteries, and his macula. I'm also going to be looking at the red light reflex. Okay. I'm going to get you to look straight ahead. Okay, the red light reflex is present. I can see the optic disc, and the blood vessels are normal, no narrowing, as well as no hemorrhages noted or any other abnormalities. Next, I'm going to inspect the ear. I'm going to inspect the outer ear. I'm going to palpate it for any kind of abnormalities, any masses. I am then going to inspect the inner ear with the otoscope. I'm looking for patency to make sure there is no wax buildup, as well as no foreign bodies. The canal is patent. The tympanic membrane is pearly and gray with no bulging noted. I can see a cone of light in the eardrum, as well as I can see part of the malleus bone. And these are all a normal finding. Now we are going to check the, we're going to do a Weber test. I'm going to tap this and put it on the top of your head. You let me know. We're checking for lateralization to see if you can hear both sides of your ears equally or if one more than the other.
Both.
Okay, that is a normal finding. Now we are going to do the Renee test. I'm going to tap this and put it behind your ear. You let me know when you stop hearing the sound.
Stop.
Okay.
Stop.
Okay, and the air conduction is longer than bone conduction, so that is a normal finding. Next, we're going to check his cranial nerves. Cranial nerve 1, I'm going to have you close your eyes and tell me what you smell.
Peppermint.
Okay, cranial nerve 1 is intact. For cranial nerve 2, we are going to be checking visual acuity. We're going to hold this card approximately 14 inches away from the patient, and I'm going to let you read the lowest line that you can.
LTFPH.
I'm sorry, cover one of your eyes.
LTFPH.
Okay, cover the other eye.
LTFPH.
Now undo both.
LTFPH.
Okay, and his vision is 20/20 in his right and left and bilateral. We're going to check peripheral vision. I'm going to get you to stand up for me. I need you to cover your left eye. I'm covering my right. Just tell me when you see my fingers coming to you.
There. There. There.
Okay, other eye.
There. 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 There.
Okay, that is a normal finding. Okay, you can have a seat. I'm going to check his pupils at this time for cranial nerve 2 and 3 for reaction to light and accommodation. I'm going to get you to look at the wall for me. They do react to light. Now I'm going to get you to look at the wall again for me, and as I come in with my pen light, I want you to focus on the pen light. Okay, that is a normal finding. His eyes did cross. For cranial nerve 3, 4, and 6, I'm going to check his extraocular movements. I want you to follow my pen light with your eyes. Do not move your head. Okay, his extraocular movements are intact, so those cranial nerves are good. For cranial nerve 5, I want you to clench your teeth for me. The masseter and temporal muscles are intact. They are clenched. I want to check pain sensation and touch at this time. I want you to tell me if it is sharp or dull. Close your eyes for me.
Sharp. 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 Dull. Dull. Dull.
Okay. As well as I want you to close your eyes and tell me where you feel this at.
Nose. Left cheek. Forehead.
Okay. Cranial nerve 5 is intact. For cranial nerve 7, I want you to raise your eyebrows. Clench your eyes together. Smile for me. Frown for me and puff your cheeks. Okay, that is intact. For cranial nerve 8, it's going to be the whisper test. I'm going to include one of your ears and you repeat what I say.
1, 2, 3, 4.
Okay, cranial nerve 8 is intact. For cranial nerve 9 and 10, we're going to make sure his uvula is midline and moves whenever he says ah, as well as test his gag reflex. Would you open your mouth for me? Say ah. And his gag reflex is intact, and his uvula does move midline. We're going to check cranial nerve 11 at this time. I want you to shrug your shoulders. Okay, move your head side to side, front and back. Cranial nerve 11 is intact. Cranial nerve 12, I want you to stick your tongue out. Move it back and forth, up and down. Cranial nerve 12 is intact. By listening to the patient's voice and articulation, we would also check cranial nerves 5, 7, 10, and 12. And all of his cranial nerves are intact. At this time, we are going to inspect the neck. I would inspect the skin for any kind of lesions, masses. I would also, at this time, palpate the neck for any kind of masses. Okay. Palpate the carotid artery. Okay, I'm going to auscultate. listen for any kind of bruise. They are 2+ bilateral and regular. We are also going to check range of motion at this time. Get you to do your neck forward, backwards, side to side, all the way around. Okay, range of motion is intact. I'm now going to palpate the lymph nodes. Preauricular, postauricular, occipital, parotid, tonsillar, submaxillary, submental, anterior cervical chain, posterior cervical chain, and supraclavicular. And I do not feel any lymph nodes present, so that is normal. At this time, I'm also going to inspect and palpate the trachea. And it is midline. As well as I'm going to palpate the thyroid. I'm going to get you to take a little sip of that once I get behind you, and I'm going to feel your thyroid. Okay, get you swallowed. Okay, and his thyroid is normal. I do not feel any abnormal loads or anything on his thyroid. Now I'm going to get you to lay back, and I'm going to assess your jugular, external and internal jugular vein. I need you to look that way for me. As I start to lay him back, I can see that his internal jugular vein and his external jugular vein become present, and they will start to bulge a little bit, and this is a normal finding. Okay, sit back up. All right. Next, we are going to inspect the back. I need you to kind of turn. Let's see. I think it's just, yeah. We are going to inspect the back for his skin for respirations, as well as the thorax and the skin. I'm then going to palpate for any kind of masses or abnormalities. Okay, we're going to do tactile pherometers. I'll get you to repeat the words 99.
99.
Again.
99.
Again.
99. 99. 99.
Okay, this is normal and it is symmetric. I'm going to get you to take a deep breath at approximately rib 10. Okay. And it is symmetric. I'm now going to percuss. And that is normal, it's resonant. I'm now going to percuss for excursion. I'm going to get you to breathe out and take a deep breath in and hold it. Okay. Okay, now I want you to take a deep breath in and hold it. Sorry, I'm going to get you to repeat that. I want you to take a deep breath in and let it out and hold it. Okay? Okay. Now I want you to take a deep breath in and hold it. Okay. And I'm going to measure this. And it is approximately 3 to 4 centimeters, which is a normal finding. At this time, I'm going to auscultate his breath sounds. Take a deep breath for me. Okay. Again. Okay. Again. Okay. Again. Okay. Last one. those are all normal bilateral with no wheezing or anything noted. I am now going to check for CBA tenderness. Is any of this sore, tender? Okay. Is any of that tender? Okay, that is normal. Okay, at this time, I'm going to turn back to the front, and I'm going to inspect his chest. I would inspect the skin for any kind of abnormalities, any lesions. I will now palpate. Not feel any abnormalities. I'm going to palpate at the cardiac points, aortic, pulmonic, Erb's point, tricuspid, and the mitral or apical point. I do not feel any kind of pulsations. However, you can feel at the apical point pulsations on some patients. At this time, I'm going to perform tactile pharyngitis again. I'm going to get you to say 99.
99. 99. 99. 99.
And that is normal bilateral. We are going to perform percussion again. And it is normal. I'm now going to auscultate his lung sounds on the front. Okay. Good. Okay. 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 I'm now going to listen to his heart sounds. Aortic. Pulmonic. Erb's point. Tricuspid. Mitral. And I can hear S1 and S2 at each point, and it is regular. I'm going to listen for any kind of murmurs or bruise at the same cardiac points. I do not hear any of that. I'm going to get you to lean back, and I'm going to listen to them as well with you, lady. Those are all normal. I can hear S1 and S2 with no bruise or murmurs. I'm now going to check your pulses. Thank you. I have already assessed his carotid. Those are both 2+. I would also at this time check his femoral pulse, but I'm not going to do that for this exam. Okay, I'm going to have you. Well, we're going to go ahead and assess your stomach while you're laying back. I'm going to inspect the skin. I'm going to inspect the curvature, the belly button. I'm going to inspect for any kind of pulsations or peristalsis. I'm then going to auscultate the lung sounds. They are present and normal in all 4 quadrants. I'm now going to listen for any kind of bruise, aortic, renal, iliac, also listen to the femoral, and there are no bruises noted. At this time, I am going to palpate, I'm going to percuss. And those are normal. I'm now going to percuss the liver. Measure that, and it is approximately 7 to 8 centimeters, which is a normal finding. I am now going to palpate, light palpation first, see if I feel for any masses. I do not feel anything. I'm going to palpate a little deeper and try to palpate the liver. I need you to take a deep breath for me. Okay, and I do not feel it. Palpate the spleen. Deep breath in. Do not feel that. Okay, see if we can palpate the aorta or the kidneys. Okay, I cannot feel that at this time, which can be a normal finding. Now I'm going to, since I'm finished with the stomach, I'm going to get you to sit back up. I'm going to inspect the arms. Okay, I'm going to inspect the arms. I would inspect the skin for hair distribution, any kind of lesions. Inspect the muscle mass. Palpate it. Do not feel any abnormalities. I'm going to check capillary refill, which is less than 2 seconds. I'm going to get you to squeeze my fingers. Grip strength is good. I'm going to check your muscle strength. Pull back on my arm. Okay, now push down. Okay, strength is 5 out of 5. Now I'm going to palpate the epitrochlear nodes, which are underneath your arm. I do not feel any present. Now I am going to inspect and palpate the shoulders. Palpate the joints. Clavicle and sternum. Okay, that is all normal. I would inspect the skin as well. We're going to check his range of motion now. I'm going to get you to put your arms above your head. Go back. Okay, cross your arms over you. The other one, above your head, behind your back. Okay, I'm going to do it with this side. Okay. Okay, his range of motion is intact. Now I'm going to move down the arm to the elbow. I am going to inspect and palpate the elbow. I do not feel any kind of crepitus or anything in the joints. I would inspect the skin as well. We're going to check range of motion. Can you do your arm out like this? In. Okay, go back out. Now flip your arm over. Okay, that is all normal. We are going to inspect the lower arm, the wrist, fingers. I'm going to palpate and inspect them. I do not feel any abnormalities. I'm going to check range of motion. Do your arms down, up, side, side. Open your fingers, clench your fist. Okay, do your arm all the way around. Okay, now open your fingers for me. I'm going to try to close. Okay, now, yep. Okay, now I want you to close your eyes for me, and I'm going to put an object in your hand, and I want you to tell me what it is. Okay.
Paperclip.
Okay. Now we are going to check coordination. I want you to do what I'm doing. Okay, that is intact. I want you to take your finger and go from your nose to my finger with your finger. Okay, his point to point is intact. I am now going to inspect the legs, the hips, his feet and his ankles. This is best with you laying back, so I'm going to get you to lay back for me. I would inspect all of this, the hair, the skin, for any kind of lesions, distribution of the hair. First, we're gonna start with the hips. I would inspect and palpate the hip. Okay, now we're gonna check for range of motion. I want you to lift this leg up, lift this leg up. Okay, I want you to cross this leg over to that one, okay? And then cross this one over. Okay, now I'll take this leg and go out, and this leg and go out. Okay, his hip range of motion is intact. Now I will move down to his knee. I will inspect and palpate his knees. They are normal. I want you to lift your knee up. Okay, and do this one. Okay, his range of motion is intact. I will then move down to his ankles. I will inspect and palpate them. They are normal. I will get you to pull your foot back. Okay, you did it both ways. Inside. Bend them inward, outward. Okay, now do them all the way around. Okay, that is normal. I'm going to check his pulses. Pedal. Posterior tibial. Popliteal. And they are all 2+. I'm going to get you to sit on the side of the bed for me. And we're going to check your reflexes. Okay, I also want to check your capillary refill, which is less than 2 seconds. Close your eyes for me. We're going to check sensation. Tell me where I'm touching at.
Left inside.
Okay.
Right foot.
I'm going to touch up here.
Right foot top. Right foot inside big toe.
Okay. And we would do that on the same, on that side as well. We're going to check all reflexes at one time. I'm going to start as brachioradial. Okay. Next we're going to check here. Okay, his fingers smooth, his hand. Just relax your arm for me. Okay. Those are all normal. Now we are going to check his patellar. Okay. Then his Achilles. Okay, and now we're going to check the Babinski. And it is normal because it does not react. That is a normal finding. Next, I'm going to get you to stand for me. I'm going to get you to turn around, and I'm going to palpate your spine. Get you to bend over on the bed. I'm going to palpate the spine for scoliosis. Okay, that is normal. I'm also going to get you to bend your waist backwards to check back, forward, side to side, and then twist. Okay, those range of motions are intact. Now I'm going to get you to come stand over here, and I'm going to get you to walk towards the wall regular. Just walk like normal. I'm assessing his gait. Okay, on the way back, I want you to walk on your tiptoes. Okay, now I want you to walk back heel to toe. Straight line. Perfect. Okay. Now I want you to close your eyes for me. Put your feet together with your arms out by your side. And this is the Romberg test, and he is not drifting, so that is a normal finding. Okay, you can have a seat for me. There is one thing that I forgot to do. That is, I'm going to get you to lay back, and I'm going to check your abdominal reflexes. And the stomach does move a little bit with that reflex. At this time, I believe that concludes my head to toe assessment.